Well, welcome back to TV5 News at 9. It's time now for Education Matters with Saginaw Intermediate School District. We are here with Mental Health Director Emily Rao and Behavior Support Specialist John Lefevre. Thank you both so much for being here. This is such an important topic. We are talking about Mental Health Awareness Month and support for students. We want to know, Emily, we'll start with you. Why is school-based mental health such an important topic right now?
Sure. I believe that school-based mental health is an important topic right now because we are seeing a lot of students come forward with anxiety and depression, and schools are our primary place where those students are. So that's the environment in which we can see these things arise and where we can address them most efficiently because we see these students every day. They make connections with their teachers, with extracurricular staff like coaches or even administrative staff. So they are the first people to see how students may be changing their behaviors if something is happening in their life, or how they are affected by certain things that may be happening within the school system. So it's really important because we're seeing a big rise in that anxiety and depression among our kids. We know that 40% of our U.S. high school students reported to feel persistently sad and hopeless in the past 2 weeks. That was some 2023 data. And another unfortunate statistic is that suicide is now our third leading cause of death among our young people. So we're really seeing some pretty daunting numbers of how mental health is impacting our youngest people.
Oh, it's so concerning.
Yeah.
John, you know, we should also talk, we've for years seen a lot of stigma, misinformation affecting everyone's willingness to go get help. Do you think that's getting any better?
I think it is. You know, we're trying to build, you know, awareness and having resources available. But one of the things Emily talked about is, you know, our staff and our students being in the building and kind of interacting with each other all the time. That's one of those huge factors is, you know, getting to know our staff members. So we have mental health staff in our school buildings. They're part of that school community. So as students get to interact and engage with them, that becomes another support person. So I think it can help knock down some of those barriers to going to see somebody that's kind of an unknown person, and now that's a familiar person to them. They see them in the hallway, they've interacted with them. So I think opening that door and maybe asking for help is easier now than maybe ever it was.
And what sort of a role do teachers play in all of this?
I'm glad you asked. So teachers, they play a vital role. Sometimes people think, you know, because, you know, we're having this conversation that teachers are now in that position of becoming a therapist or a counselor, and that's not the case. I would be remiss if I didn't say, you know, it's Teacher Appreciation Week as well. So a huge kudos to all the teachers, because what we're really asking of teachers is to continue to do the hard work that they're doing, not just with teaching the academics, but building those relationships, making those connections. Our teachers and educators, they're oftentimes the first person that might see the student walk in maybe with their head down, or a student that was a shining star academically is now making that kind of that withdrawal, or maybe they're stepping back from certain activities, or some of those minute changes that we see in student behavior. We can catch those early because of those really powerful relationships that students and teachers have.
That's interesting. We should also talk about, you know, Saginaw ISD and what it's doing to really expand mental health services, and partnering also with community groups to join the mission.
Yeah. So right now we are currently utilizing our 31N funds from the state of Michigan. We use those funds to be able to bring in mental health practitioners to, I believe we have 10 mental health practitioners that are in schools all across Saginaw County. We do have the funds within that to expand now for 2 more mental health practitioners. We also partner with local agencies like CMH, the Barb Smith Suicide Resource and Response Network, other community agencies and partnerships. I'm always looking to expand and increase our partnerships with these folks, because really we have to think about what can we do within the school day, but also what happens when these students leave our care in the school system, and making that kind of whole community approach to taking care of these students so that they have access not only in the school but outside the school as well.
And when we're talking about parents and grandparents, families are so busy. This is a hard time. What is the one big message you want people to take away from this?
I think knowing that as we continue to have these conversations about student mental health, that the importance of getting your student help and listening to and having conversations with your student and with your child, I guess I don't want to say student, but with your child to know where they're at and to understand what's happening in their life, because sometimes there are things that happen that they might not feel comfortable talking about, or they might not know that you really do care and you really do want to listen to them. And I think knowing that what we're doing at the level that we're at is bridging those gaps for them, is taking away some of the barriers like transportation or funding costs to be able to give their child access to these services without causing any sort of friction for them, and undue stress for them.
Wow, so many good nuggets of information here. We appreciate you being here. For more information, too, about what we're talking about, go to the Hot Links page that's on our website right at the top at WNEM.com. You'll find all the information there you need. Thank you for being here.
Thank you for having us.
Thank you for having us. Appreciate it.
We're back in just a moment.